Good afternoon, first year family nurse practitioner students. My name is Faith. I'm a student like you. In my senior year at the family nurse practitioner program. And today I want to lecture about evaluation of acute abdominal pain in primary care. Now, abdominal pain is one of the most common chief complaint in adults and pediatrics in the primary care setting. And the goal is to be able to differentiate whether the patient is indicated for emergency referral. Now, the objectives of this lecture is I want you to be able to identify the different types of abdominal pain. I want you to be able to describe the signs and symptoms and red flags of acute appendicitis. And lastly, I want you to be able to describe the special tests when needed or that can be used when examining for appendicitis. So what is abdominal pain? Abdominal pain is a discomfort or distress that is occurring in the abdominal region. There are two causes. It can either be organic or non-organic. So organic is type of it's a cause that is disease-based. It's an inflammatory. It could be an inflammatory cause. It could be an anatomic, physiologic, or metabolic causes. On the other hand, non-organic cause of abdominal pain is the kind of pain that is functional, meaning there's just no clear cause despite the symptom. Now, abdominal pain can be either acute or chronic. Acute abdominal pain is the kind of pain that lasts from several hours to days, whereas the chronic type of pain is the kind of pain that remains unchanged and it can occur from months to years. Next, I want to talk about the different types of pain. There are three types: visceral, somatic, and referred pain. The visceral pain is the kind of pain that is an inflammation or injury of an organ. It can be described as dull, constant, or poorly localized pain. The somatic pain is the kind of pain that is an inflammation of the peritoneal lining, and it is described as a sharp or well-localized kind of pain. Lastly, the referred pain is the kind of pain that is radiating to an area outside of the abdomen. Even though the cause of the pain may be, from an organ, the pain is then referred outside of the abdominal region. Say you're getting referred pain in your shoulder or in your back, things of that nature. Now, I gave you a handout earlier. So these are the abdominal conditions based on pain location. I just wanted to review and look closely, what are the pain locations. It could be, if it's right upper quadrant, left upper quadrant, and what kind of disease processes that, it's usually associated with which organ is where, based on, on the location. So I want to talk about appendicitis. Appendicitis is the most common acute abdominal pain diagnosis in primary care. So it is defined as an acute inflammation of the appendix wall due to fecal blockage of the lumen that can result to distension or bacterial infection. Further, it can cause result in gangrene and perforation, which are all it's an intra-abdominal emergency if that happens. Next, I want to talk about the prevalence of appendicitis. So appendicitis happens there's about 300,000 appendectomies that happen annually in the United States. It usually occurs between late teenage years, 10 to 19-year-olds, and late 40-year-olds. And it also mostly occurs in males than in females. So here are the presenting symptoms of appendicitis. I bolded the ones that are red flag symptoms. The first one is the low-grade fever. The next presenting symptom is pain. Pain that is sudden, onset, and severe. The hallmark is the pain that wakes up a patient at night. So that's, when a patient comes in and he tell you, I've had this abdominal pain that, it really woke me up last night. It's so bad that, it'll click that, okay, this is one of my differential diagnoses is appendicitis. Also, another red flag symptom that is really gonna differentiate you to say that, oh, this is an appendicitis diagnosis is the migration of pain from periumbilical that started from the periumbilical area that moved towards the right lower quadrant. So I have a little illustration here. So the periumbilical area is like that surrounding area around your umbilicus. And other symptoms that could also present with a patient that has appendicitis is nausea, vomiting, diarrhea. So physical exam, you want to examine your patient when they come in with abdominal pain. You want to look at their vital signs. Are they having, hypotension? Are they having, tachycardia? Are they having the fever? You'll see that in their temperature. Look overall, general, are they in distress? Are they guarding? Look, in their skin, are they diaphoretic? You want to look into their mouth and throat as well. Listen to their heart and lungs. And you want to focus on the gastrointestinal area. You want to use the IAPP system. You want to inspect first, look around the skin and the abdomen, any masses, rashes, jaundice. Next, you want to auscultate using your stethoscope. Listen to the bowel sounds. Next, you want to percuss. Is there gas or fluid? And lastly, you want to palpate. And when you palpate, you're looking for tenderness, masses, and things of that nature. Lastly, I want to talk about the two special tests. These are two special tests that will help a clinician really differentiate and pinpoint then that the patient is having an appendicitis. The first one is called the Iliopsoas sign, and I want to show you a video to demonstrate how it is done.
A positive psoas sign is another indicator of acute appendicitis. The appendix lies close to the iliopsoas muscle, so if the appendix is inflamed, any maneuver that tenses or stretches the iliopsoas muscle may result in increased right lower quadrant pain. There are two ways to test this psoas sign. One way is to have the patient try to flex the right hip by raising the right leg against the resistance of your hand. Tom, I'm going to have you raise your right leg against my resistance and let me know if you have any pain. The second way to test the psoas sign is to have the patient roll onto his left side, then grasp the right leg and extend it at the hip. This stretches the psoas muscle. Increased right lower quadrant pain with either of these maneuvers is a positive psoas sign. Tom, I'm going to have you roll on your left side. And I'm going to extend your leg and let me know if you have any pain with this. Okay. You can turn back over to that.
Next, I want to show you about the obturator sign.
The obturator sign is another sign of appendiceal irritation. The internal obturator muscle lies close to the appendix on the right. When this muscle is stretched in the setting of an acute appendicitis, the patient experiences increased right lower quadrant pain. To perform this test, flex the patient's leg at the hip and the knee, then internally rotate the hip. This stretches the internal obturator muscle. Okay, Tom, I'm going to flex the knee and the hip and internally rotate and let me know if you have any pain with that.
Allows you to breathe out. Okay? So it connects to these vertebrae here and it goes through the pelvis to the inside of your femur or your upper leg.
Thank you. All right. So now I wanna go over a case study to examine, if you've learned anything from the lecture I've just went over. So John Smith is a 19-year-old male college freshman. It is finals week and he is stressed out. One night he awoke from sudden severe periumbilical pain. He took some Tylenol, sucked it off. Now next morning, the pain is in his right lower abdomen and is feeling feverish. As he was taking his anatomy and physiology exam, he had to run out of class because he started vomiting. So the first question is, what type of abdominal pain is he experiencing? Rachel?
Is it visceral pain?
What makes you think it's visceral pain?
It sounds like it's like an inflammation or dull, severe periumbilical pain.
So what's like getting inflamed?
Probably an organ.
Okay, makes sense, right? Great. Next question. So John Smith went to the student health clinic to have himself checked out. As you were assessing him, what red flag symptoms did he mention happened? Karen.
He had the pain that woke him up from sleep and he had fevers.
What else?
He had that migrating, the periumbilical pain.
Great, correct. Lastly, what's from the videos I showed you, what special tests would you perform to aid you in diagnosing him?
I would do the iliopsoas and obturator sign for him.
Great job. Any questions? All right, I hope this lecture was informational, and the goal is, like I said initially, early treatment will result in good prognosis, and we wanna, as family nurse practitioners in primary care, the goal is, we wanna differentiate whether the patient is indicated for emergency referral. And these are my references. Thank you.